concept. This is a patient-centered service. It's a service-based concept. It's not a commercial concept. And what we do here is we give a 1 hour per month free or subsidies. Just 99 rupees is quite good. Get nothing in it. In India, even a pack of cigarette, people are so fond of it. It will cost you more than 200, 300, 400 rupees. So when something is damages your health, cost you 500 rupees. If you can't afford 900 rupees, then I'm sorry. God only the access. So there's a 1 hour per month free session, exercise Zoom session. Whenever I'm, so obviously when I'm in UK, I find this money. As I mentioned, there's no free meal in life in the West. It's very difficult to find, and even if you ask me to it, honestly, this month is became New Year, and the whole of the month till 15th of February, my daily is booked with surgeries, work, conference, and everything. Do even eke out this 1 hour time for all of you guys for free or for the subsidized amount is extremely difficult for me. So you can just imagine the amount of sacrifice one has to do to come and educate our people to healthcare facility in India. It's unbelievably difficult task. So I would expect the people to use this time. Use people, don't abuse. This is a mantra. So this is a 1 hour per month free or subsidized. So you can ask any questions, and I would sort of allocate 10 minutes, per patron to ask the questions, because you can't have the like just because you are free, you can't take other from this. You need to be conscious about others also, because they also have a life and they also have work person problems. It's as important to them. Like the problem you are facing is important. So what I do is I would unmute the participants sort of one by, and then you can ask questions. So what I would say is, since it's on the Zoom platform, you have to maintain your own confidentiality. Suppose, imagine that you are a patient, your name is Srikanth, and you are age 60, just imagine. Okay. So you want to discuss. So all that you could say is that you don't need to tell. You can say, I have a patient who is 60 years old. Age is important. You don't tell lies to doctors, and biases. So you have to tell the correct details, and whatever formality you got, you pen and pad. And this is the problem I have. Something like that. So you can say. And give a brief history, just for 10 minutes. And if you have some reports, you can even read it, and sort of the advice will be given to you about what's the best way to go. So like that, we'll cover around maybe 10 minutes each in 60 minutes. 6 people you can cover. So the rest of them will, be taken for the next session. So that's how the model will be. So, before that, I'm seeing on Facebook quite a few questions. I'll take one question. I think this gentleman's name is Jagadish Asistan. He's around 50 years old. He's got a knee problem from what he's saying. And he wants to, he's been advised for surgery by few hospitals and doctors in the city. And he wants to know, is that the right way? So I think what Jagadish has posed is a very, very interesting problem. And I think it's a very, very important thing for all of you who have joined online for me and will watch it later. So the issue here, what Jagadish is facing is that he has got BP. So if there is pain, that means there is something wrong with the knee, some damage. Nature doesn't produce pain if everything is perfect. If everything is perfect, you don't compare that. With pain makes you turn to the dentist, knee pain makes you to doctors and surgeons like me, or head pain makes you run to a physician, like that. So pain is an indication that there is something wrong in your body. And you should not ignore it. For example, chest pain. You should run to a cardiologist. You don't run to a cardiologist. Then what happens? You think it's gastritis, take some Gelusil, some, Gaviscon, and settle down. When you never know. Next level, you may be not alive. And this is the reality. We're living in a post-COVID world. And in a post-COVID world, what we mean in a post-COVID world is that, post-COVID world is a sick world. So COVID was a pro-inflammatory condition. It has affected every human being. And vaccine itself acted like a COVID. It used the same immune response. So it's also pro-inflammatory. So that means there is incidence in the world of inflammation, say of the pancreas causing pancreatitis, which means most of the people will be diabetic in the world. There's a diabetic capital in the world. And similarly, myocarditis means there's a increased inflammation. So you may be a six-packer going to the gym and doing all the right things and saying, hey, look at my biceps and my pectorals. Huh? But there's a chance that you might die suddenly of heart attack, and, because of the underlying myocarditis. So, as I said, COVID, post-COVID world is a sick world. It's called post-COVID syndrome. So you should not neglect. And if there is chest pain, run to the doctor. It doesn't matter you are 21, 24. It doesn't matter you are regularly going to the gym and 10 miles a day. You've got 6 or 8 packs in your body. Second. So, alasam amritam mission. So, if you neglect your health, you will pay the price. And sometimes with life, sadly. But learn lessons in the next life. So, pain is a very important symptom, and pain is some damage going on. So, don't neglect. So go and see a doctor. That's the most important. So now the dilemma with Jagdish faces, he's a young person. Okay. And we know that, we start doing a joint replacement surgery in young people who are of his age. Then the joint itself will last not for very long. Usually the first joint replacement done lasts typically 15-20 years. And second joint replacement but revision done lasts roughly half the time. Suppose it lasted 20 years first time, the second one will last 10 years. And then the third one will last half of the time, is 5 years, and then 2.5 years. So each surgery has got a diminishing return. So that's why joint replacement surgeons and people who are very honest experts in the world try to advise patients like Jagdish to push joint replacement surgery as long as possible. Maybe to age of 60, 70 like this. For example, you were 60 and you have a joint replacement. But a good surgeon, you see a good surgeon, he knows what he's doing, he's probably trained in a normal medical college, UG, PG, and great fellowships in India. So then that joint will last for 20, 60 plus 20, 8 years. So he comes to you for revision at that time. It's failed now because it's simply loosening. And when it's failed, you do a revision. So that revision will last 10 years. I think it's 80 plus 10 is 90. So then next one will last up to 95. We don't know. In 1995, we may not be alive again. So this sorts of solves our problem. Okay, that's why joint repair surgery has to be pushed as much as possible beyond 60, 65 years. Now, the problem Jagdish is facing is very, very unique. So, because he's young, we call it as a young arthritis patient. And this is one of the most challenging situations in the world of arthritis, how to deal. So, suppose he was very young, suppose that 20, 30, we definitely say, go away, get some physiotherapy, take them reduce weight, and quit smoking, stop alcohol, do exercise, go for morning walk, do yoga. So all these things you would say it is very young. Okay. But so now he is like 50, where joint surgery is not ideal. At the same time, he's not 70, where easily you can do a joint surgery. So you're caught in a dilemma. So you're caught between devil and the deep sea. As I said, devil and the deep sea. So this is the dilemma that every good doctor faces, every good surgeon faces, not just in India, but in the society. So this is a separate chapter. In orthopedics, this is a separate chapter. How to deal with a young arthritic patient, whether it's a hip arthritis patient or knee arthritis patient. So the real answer to Jagdish would be, there are several methods to do. So one is, I'll go in a very hierarchy way from the evidence-based way. I'll go from, for example, least intervention, least cost to most intervention and most cost. That way I'll go. So, like generic advice, what the advice for Jagdish would be, if his obese has to be, as we know, the knee joint takes 8 times more. If Jagdish is 100 kgs, the knee is taking 800 kgs. So by loading 800 kg, he's saying, oh, I can't tolerate this. That's why the pain is coming. So if this body is telling, go ready. He says, MBA, mujhe bahut aata hai. Who are you to tell me? Suffer. It's as simple as that. So nature is telling you, act. Whether just pain, saying heart attack, you say, hey, Don't you know I'm किसका बैठा हूँ मैं मुझे नहीं जानता next minute you're dead, finished. So you can take next birth and be a prime minister himself or chief minister himself. Okay. This is how nature is. No forgiveness in nature for arrogance. So what he has to do is first reduce weight, second is quit smoking. Smoking is a big epidemic and endemic in India. Until youngsters, then quit alcohol, abuse alcohol, very important. And engage in exercise, walking, yoga, swimming, and these kinds of things are extremely good for joint. And having done all these things, and seeing physiotherapy and get range of movement going and things like that. The intervention, as far as intervention is concerned, is he has to see the correct doctor, correct organization. So now in India, what is happening is one of the doctors, get a proper X-rays of the knee, like a standing, after standing. I see 9 out of 10 X-rays, that is 90% I see in India in the APN left. Sometimes not even standing. So this is inadequate. My boss, Richard Parkinson, would say, he has got 3 joints, 3 X-rays. If you have not done 3 X-rays, you are not assessed the knee completely. That means 1/3 of the joint you have left. So obviously, even if you do a knee replacement, because you are not assessed 1/3 of the joint, you will get pain. The patient is an unhappy patient. Now they will say, after take care, my patients, 20% of patients are not happy. Whose fault is it? Your fault, because you didn't assess, you didn't even do proper X-ray. Forget treating properly. So go to the correct orthopedic surgeon, get the proper X-rays. After the proper X-rays, I think the best way would be when you exhausted all the conservative physiotherapy, exercise, painkiller things, you can try an injection with the knee. First thing, simplest is an injection of a local anesthetic, which takes the pain away because you come to the doctor. Second, a combination of a mild corticosteroid. And corticosteroid, a lot of myth in India, they think it's a devil. But adrenal glands produces steroids in the body. Yeah, without steroids, you're dead. Flight or fright response. Somebody tries to hack you, attack you. You have to either fight that person or you have to run away. So this flight or fright response, depends on corticosteroids or steroids, which you hate. Yeah? So without steroid, you are dead because either he will hack you and you can't kill this person because there is no fight response. Okay, so don't be showing thoughts to the sun, saying steroids are bad. You don't know anything about steroid. Yes, steroid is good because your body is producing it. Without that, it's not. Nature is not stupid to learn from human things. Okay, so this is a very good time-honored thing. We've been doing it for 100 years and things like that. That is number one. Number two, a little bit more advanced last 2 years is what is called separate transplant. So what do we do here? We take patients on bed, 16 ml, we centrifuge, and we put a layer, RBC settle in the bottom, the science students will know, and the plasma is settled in the top, and there is a plasma which is rich in platelet. What is a platelet? Platelet is something which heals your body. So it's called a healing function. Suppose you cut your hand, okay, blood starts coming. So what is the first thing which prevents the bleeding? There's a platelet. Platelet comes there, creates a plug, starts bleeding, puts all the regenerative growth factors there, and it heals fibrous tissues from healing up. So we are using the God-given platelets to do the same thing in the joint. Once we inject it into the joint, it does the same thing. Basically produces growth factors. The growth factors help in healing. This is like a tissue regeneration. So very well used. Great people like Rafael Nadal and all top tennis stars have used. So it is nothing really new. So beyond that, we've launched a couple of things. Called Joint Widow. It needs probably a full class. I will deal with it in a fashion. But this is a regenerative medicine at its best. This basically is like creating a new heart, new joint, or a new muscle, or a new intestine, or a new brain. It is at that level. Very scientific, and it's a little expensive, but that is a whole day stock, and maybe some of you have it. It will be there in the YouTube in sections and things. You can go watch it for free also if you are subscribed. So this is in short what Jagdish can do, so that he gets extra 10, 15 years So that from 50, he becomes 60, 65. And when everything else fails at that time, doing a joint surgery would be good for Jagadish. So this is, I answered this question. Okay. There's only 5 minutes left, so we'll go to the last section today. That is, I take this opportunity to thank all of you for attending, both offline and online, particularly on Facebook and YouTube Live, and also those who came through the Zoom session. Thank you very much. The whole idea is about this meeting is service. So we need to get that very, very clear. If you really liked what we discussed today, and you see this value, to meet me, Western white people spending 20,000 rupees an hour. Just imagine kind of value you got just today. For absolutely 0 rupees or some paltry rupees 19 rupees. I charge 19 because I want serious people to come. I don't want non-serious people to come. Otherwise, a free means everybody will come. So that's why we kept it. Just the people who are coming. So if you really like the value of what we talked today, particularly Jagadish and people like Jagadish, there are billions and billions of people suffering in India who don't have access to quality healthcare, health literacy, and we don't have enough doctors and surgeons in India. Most of the healthcare is run by packs, villages and cities and everything. There's so much of mixed between that. So if you really like and value what we have given to you, so follow us on our social media. Okay? So my YouTube channel is youtube.com/Dr. B.R. Srikanth, SRIKNH, my initial KN 4422. Okay, so that is Dr. Srikanth KN 4422, question mark, sub SUV _ then confirmation CONFIRMAN is equal to 1. So this is my YouTube link and Dr. Srikanth KN 4422, question mark, sub _ confirmation is equal to 1. So you have to go there and subscribe to the YouTube channel or give us a review on the Google. You can see the QR code there on the right-hand side. The next slide also I'll show you a proper people-sized QR code. You can take a screenshot of this and then go to Google, SSOC, and give a review. Or follow us on social media like Instagram and Facebook. And, some patients, particularly people like Jagdish, have already joined a self-help community group of arthritis sufferers. And, this community is basically, helping them to cope. And what is happening in this digital world is that although we are so much digitally connected, we are lonely. And both elderly are lonely in this world in 2026. And also Gen Z, they are also feeling lonely. And a number of people are committing suicide. It's a big epidemic. It's going to hit the world in 2026. Okay? So that's why there's need of today in 2026 is a community where people in similar shoes, can help each other. That's why we created an arthritis community, and people have joined this community and they're benefiting a lot. Okay? So, it has got a lifetime charge of very paltry 9999, and with that they get a lifetime access. And what's happening in the communities, not only they are able to communicate with other arthritis sufferers in India, or exchange some ideas and things like that, but they are also taken through fundamentals of everything, fundamentals of a human body, fundamentals of a joint. What is a joint? How it is made, fundamentals of disease, how a disease occurs, is a types of arthritis one can get. Like Chikmaga said, Adam and Eve, first man created on world, suffered from arthritis. Okay? So if he suffered, then what is us? What is you and me? Right? So it takes you into the types of arthritis and takes you a detail into the types of non-operative treatment, including everything what I mentioned to just now, and also takes you into the high end, with the robotic surgery, beyond the robotics, joint replacement for life, which most orthopedic surgeons in India will also not know. So and augmented reality, AI in orthopedics, AI in medicine. So it takes you to everything. So whatever is the latest, people come and ask, sir, what is the latest treatment? So you get the latest treatment with just a pattern 999, but to lifetime access. Okay. And also you can communicate with other arthritis sufferers. Okay, so that you can help each other. Krishna said, Kaliuga Sandaste is a strength. That means that we join together, that is a strength. Okay. So I thank you very much for patient listening. So take a snapshot of this. This is the Google QR code. Take a picture. You can pause it and take a picture. Then you can scan it and do a review for the system, for what we are doing, the kind of changes we are introducing in the system, trying to make it into like the West. We say experience Europe and Bangalore, experience UK and Bangalore and India, and it's my passion. I'll keep doing it. It doesn't matter. Anybody helps. It doesn't help. It's up to you. What I have to do, I have to do. Depending on somebody praising me, not praising me, the secondary thing. Frankly, I don't have time for that. I know my patients wait around 2 years, 3 years for me to do joint surgery in UK, and I'm very grateful. That's all I need. So here I come, I do these kinds of teaching. That's what I spend time. Okay. So the next session is likely to be in February or next and make sure that you book in advance and through the XP system. And even if you have to pay 100, 1,000 rupees, throw it in. Because as I mentioned to you, so suppose somebody is sitting in Malda and he has to come from Malda to meet me in Bangalore. So imagine he has to take 2 or 3 days bus or train journey on Kolkata. Kolkata has to take an expensive flight. Nowadays, there's monopoly in India, Indigo or Air India, you know the stories. So essentially, you are paying 20, 30,000 rupees for a return flight at least. Then you have to come to a costly school like Bangalore. Accommodation itself for 2 days will be 30,000 rupees. Then you have to travel to my center and get X-rays done, investigation. So overall, you're spending 2 to 3 lakh rupees minimum just to come and go back to Malta. Just imagine sitting at a home, click of a button for a paltry amount of 9999. You're getting the whole thing, in front of you, in your house, in front of the house. You saved 3 lakhs already. So look at the value of it. So good. So I think it's 7 o'clock exactly now. Time is up. As I say, again, time is money. That's what UK has taught me. So thank you very much for coming today. And we'll connect in the next session. I'll let you know that this one. And those who have got interest, you got actually this one, you can register interest in next meeting now only. We can't take an infinite number of people. So first come, first serve. And I think we're going to stick with the 6 people maximum next time. Thank you.
So thank you all for those who have joined. I think it was fantastic, and probably this is the last one for the year. I think it looks like maybe next one will be in sometime August. So till then, goodbye, and enjoy all this charitable kind of concepts and work. And I wish you the best of luck, really. Okay. So I'm off to UK now, and we'll be back. Once I'm back, we can reconnect and do all these charitable works again. West, as I just mentioned, time is money. And in fact, they really value human beings, and their that's why the labor cost is very high in the UK, unlike India, really. So it's something government has to do: fix a minimum wage and make sure that laws are implementable. Because the problem is corruption from whom to do, and nothing gets done in this country because every rule has exception, and that should not be the way it is. Okay, so best wishes to all of you. Bye bye.